Mr. Speaker, on January 29th, I asked the Minister of Health about directly funding community organizations providing mental health services and removing taxes on counseling as direct action we as parliamentarians can take for improving access to mental health services. Before the pandemic, many Canadians were facing the reality of living with a mental illness. Now, survey after survey finds Canadians' mental health eroding as the pandemic continues. This is a crisis that will have a lasting impact on the lives of Canadians. In the last year, every time I have asked a question to the minister regarding mental health, I was invited to check out the wellnesstogether.ca portal as an example of the work being done to help Canadians. I'm very familiar with this resource, and I know it can be valuable for some people. But we also need to acknowledge that we can't fix everything with a virtual Band-Aid. These issues are complex and nuanced, and an over-reliance on websites and the digital formats is not enough. Mental health is not a luxury. It is a necessity. The mental health care system in Canada is not meeting people's needs. Long wait lists, inequity, and underfunding are the root cause of the problem. Lengthy wait times are a barrier in part because there has been a chronic underfunding of community-based mental health services and a reliance on intensive, high-cost services like hospitals and acute care. And the consequences are life and death. Once the patient finally makes it onto a list to receive care, they can wait anywhere from 6 months to 2 years to see a counselor. If you can afford it, you go to the private sector. It's a two-tier system that accentuates social inequalities. Data clearly shows that lack of access to mental health care is most pronounced in those with lower incomes or with disability. In Canada, only 7% of the healthcare budget is dedicated to mental health and behavioral health, while experts recommend it should be higher. In my home province, we spend even less. As members of the All-Party Mental Health Caucus, myself and other MPs are in search of solutions. We listen to organizations, stakeholders, people who are working on the ground to try to provide services the best they can. One of the ongoing challenges is always a lack of consistent funding. We need to ensure direct funding for organizations and communities across this country who have the solutions ready to deploy. Funding community-level interventions to alleviate pressure on our acute care system will get people the help they need as fast as possible. This is the very least we can do for the family of 16-year-old Lexi Dakin, who wasn't helped after having waited for hours in the emergency room. I want to take this moment to also honor Monique Paul from St. Mary's First Nation. She was Wolastoqey, she was loved, she is still loved and missed every day. The impacts of suicide and mental illness are particularly hard-hitting in Indigenous communities. Intergenerational trauma and systemic racism have left a painful legacy. Every time someone is lost, especially a child or youth, the frustration and hurt are heavy, like a storm cloud hovering over the community. Individuals cannot carry this burden alone. Communities cannot carry this burden alone. We need help, more help than a virtual portal can provide. It's time to lead, to build a better system that will truly be there for Canadians when they need it. Thank you, Mr. Speaker.
Honourable Parliamentary Secretary to the Minister of Health.
Thank you, Mr. Speaker, and thank you to my honourable colleague for her intervention, these questions, and her advocacy for mental health supports. We agree, Mr. Speaker, that the need for support for Canadians in mental health is substantial. And I want to thank her for this opportunity to speak more about the programs that we have in place. She is absolutely right that prior to COVID-19, mental health was a significant concern, with 1 in 3 Canadians experiencing mental illness or problematic substance use during their lifetime. Our government recognizes the seriousness of this problem and has taken a comprehensive approach to mental health. When COVID-19 struck, our government took action to address the mental health needs of Canadians and alleviate some of the burden on provinces and territories. 500 million of additional support was provided to provinces and territories for immediate mental health and substance use service needs as part of the $19 billion Safe Restart Agreement. We also provided $7.5 million in funding to Kids Help Phone to provide young people with mental health support. We launched Wellness Together Canada, which the member mentioned, on April 15th, 2020. It offers a range of free mental health and substance use supports to individuals across Canada on a 24/7 basis in both official languages and with interpretation available during phone sessions in over 200 languages and dialects. Supports include access to peer support networks and confidential text and phone sessions with mental health professionals, and a dedicated text line for healthcare workers and frontline personnel. Since its launch, over 1.2 million individuals in all provinces and territories have accessed Wellness Together Canada in over 3.6 million web sessions. Our support of this initiative continues through Budget 2021, which provides $62 million to Wellness Together Canada so that it can continue to provide Canadians with tools and services to support mental health and well-being, so that Canadians can access timely, evidence-based care, treatment, and support. Budget 2021 has also committed $45 million over 2 years to help develop national mental health service standards in collaboration with provinces, territories, and key stakeholders. Because, Mr. Speaker, as the member opposite points out, we need a multifaceted approach to providing supports to Canadians for mental health. I want to also point out that in recognition of the intersections between mental health, gender, race, and occupation, Budget 2021 also provides $100 million over 3 years for mental health projects and $50 million over 2 years for mental health programming to support these high risks of experiencing trauma brought on about the pandemic. Mr. Speaker, to conclude, we know that there was investments needed prior to COVID, significant investments in mental health throughout COVID, and frankly, that once we get through this pandemic, the mental health and well-being of Canadians will continue, and we will be there for them. Thank you, Mr. Speaker.
The honourable member for Fredericton.
Thank you, Mr. Speaker. There are tangible solutions, some of which are underway, and I recognize that. Not only earmarking dedicated funding in the health transfers for mental health, but the recent commitment for this government to define and implement national standards for mental health care, and I'm grateful. We also need to put mental health in the Canada Health Act and provide provinces and territories with the help they need to do it well. Best practices can be shared, but ultimately, Canadians need to be able to receive quality care regardless of where they live in this country. Mental illness is linked to many challenges we are facing collectively, and the longer an illness persists, the more difficult it is to treat. Early intervention leads to better outcomes. We know that every $1 invested in mental health saves the health system $2. Beyond the monetary argument, quality of life, safety, and well-being can be greatly improved. We need access when and where people need it. I want all Canadians to know that if you are facing mental illness, you are not alone. We will continue to advocate for better mental health services for all every month of the year. Thank you.
The Honourable Parliamentary Secretary to the Minister of Health.
Thank you, Mr. Speaker. And again, I thank the member opposite for her advocacy for high quality mental health services. It's something we are committed to as well, as I've mentioned in the investments outlined above. But with that, the member opposite spoke about the need for the national standards, and we are working collaboratively with provinces and territories, as well as stakeholders, and I encourage to continue to work with the member opposite for additional ideas, because again, Mr. Speaker, we know that even after this pandemic, the supports and the mental health needs of Canadians are going to continue. We will continue to improve services and access and make sure that no Canadian is left to suffer in silence. So we continue to work with all members of this house and community providers that can provide this service is something we are absolutely committed to working with, because we want to make sure that all Canadians receive the help that they need.